بسم الله الرحمن الرحيم. أنا الدكتور عبد الحكيم عكور، أستاذ مشارك في قسم الصحة العامة وطب المجتمع. محاضرة اليوم عن Occupational Lung Diseases من ضمن محاضرات الصحة العامة في الموديولز. Let's begin. Occupational lung diseases, all these are caused, aggravated by exposures at the workplace with a wide range of respiratory diseases similar to that found outside the work environment. So these occupational lung diseases are specifically caused by the exposure at the workplace, but they would be similar in the symptoms with other found or that we see outside the work environment. So it is all these is not a single diagnosis, but rather encompasses a range of pulmonary diseases. For example, occupational asthma is the most commonly diagnosed OLD. The other OLDs may include acute or chronic conditions ranging from hypersensitivity pneumonitis to chronic obstructive pulmonary diseases to pulmonary fibrosis. So this is a wide range diseases that have a similar, let's say, etiology and course of symptoms and the pathology. So multiple phenotypes of lung diseases may coexist in a worker. يعني ممكن يظهر عدة أمراض من هذه الأمراض المسببة بسبب التعرض إلى exposure في الworkplace. Like when we talk about coal mine dust lung disease, which includes classic nodular pneumoconiosis, COPDs, dust-related diffuse fibrosis, and small airways disease. Most all these, especially pneumoconiosis, result from multiple years of exposure and are associated with an important hallmark of the disease process known as disease latency period. يعني هي مسألة تراكمية من أول ما يحصل الإكسبوجر، التعرض إلى مسبب المرض حتى يظهر المرض تأخذ فترة طويلة من الزمن. This means that the disease typically appear at or after at least and commonly 20 or more years from the first exposure to the recognition of clinical symptoms. Some diseases may first appear and even progress many years from the end of exposures. Dust are either inorganic, coal dust, silica, asbestos, or organic, cotton dust, grain dust, mold spores. Respiratory conditions associated with inorganic dust are pneumoconiosis, results from direct effect of dust on lung tissue. Occupational Safety and Health Agency OSHA, established national permissible exposure limit PEL for all inorganic dusts associated with disease. يعني هذه عبارة عن قياس اسمه PEL اللي هو permissible exposure limit، يستعمل في كثير من القياسات التي تسمح أو على الأقل تقيس ما هو الحد المسموح عند التعرض اللي هو permissible exposure limit. عند هذا الليمت انه بعديه او اذا ما وصلت الى هذا الحد او الليمت لا يصيب المرض، وبالتالي الاكسبوجر اكثر من هذا الليمت for all inorganic dusts associated with disease سيؤدي الى ظهور المرض بعد التراكم طبعا. Diseases resulting from most organic dusts are immunologically mediated. إذا هي يعني بسبب الحالة المناعية، except for cotton dust, which is probably related to endotoxins presence in cotton dust. وبالتالي هي سموم بالنسبة للكوتن، لكن فيما يتعلق بباقي الأورجانيك داست هي مناعية، أي بمعنى أنه يحدث هناك رياكشن مناعي ضد التعرض لذرات الغبار أو ما شابه. Cigarette smoking increased the risk of lung disease in occupationally exposed workers. In most cases, the disease risk is additive، يعني plus. إذا بنقول إنه التوتال ريسك سيساوي الريسك of smoking plus risk of exposure additive. لكن الexception to this rule is the multiplicative risk between asbestos exposure and cigarette smoking in the occurrence of lung cancer. يعني إذا كان هناك تدخين، دخان، ناس بتدخن وتعرضت للأسبستوس، فالريسك بصير مضاعف أضعاف كثيرة، خاصة فيما يتعلق بظهور سرطان الرئة. نيجي الآن للبيردن. قديش هذا الاوكيبيشنال ديزيز بيردن قديش بكلفنا، قديش هو بالنسبة للهيلث سيستم وبالنسبة للأمراض بشكل عام. Occupational disease burden was estimated كيف نقيسه؟ by occupational population attributable fraction PAF or attribution in case series, incidence rate ratios or attributable fraction found in an exposed group. إذن هذه القياسات اللي ممكن تلاقوها عندما تقرأوا أي papers articles related للقياس البيردن، قديش إنه هذه الأمراض اللي لها علاقة بالتعرض للأوكيبيشن المهنية، الأمراض المهنية خاصة في اللنج، قديش من كيف نقيسها. هذه هي التيرمز اللي بنستعملها. Exposures in the work environment substantially contribute to the burden of chronic respiratory disease. إذا نيجي نستعمل هذه التيرمز. This includes idiopathic pulmonary fibrosis الباف 26% اللي هو قلنا عنه population attributable fraction. الأسمة 16%، COPD 14%، chronic bronchitis 13%. Other granulomatous diseases such as sarcoidosis. Occupational burden هون خاصة بالoccupational burden 30%. Pulmonary alveolar proteinosis occupational burden 29%. Hypersensitivity pneumonitis occupation burden 19%. Tuberculosis occupation burden 2.3% and 1% in silica exposed workers and healthcare workers. And community acquired pneumonia in working age adults الباف قياسه 10%. فزي ما لاحظنا اللي هو البلمونري فايبروسيس اللي هي idiopathic عادة هي أعلى شيء كpopulation attributable fraction 26%. الأسمى 16%، COPD 14%، chronic bronchitis 13%. هذول يعني يمثلوا تقريبا من أعلى الأمراض المهنية اللي لها علاقة بالأمراض التنفسية. Not counting the classic occupational pneumoconiosis اللي هو الباف له 100%. Granulomatous diseases such as sarcoidosis have the highest occupational burden 30% and can be seen among workers in metal exposed firefighters, lumber industry الأخشاب rocker glass wool and emergency responders to the World Trade Center disease or disaster في 2001. يعني عموما اللي هو الoccupational burden للساركويدوسيس اللي تقارب يعني من الكانسر أو قريبة من الأمراض اللي هي تسبب الجرانيوماتوس disease can be seen among workers في الميتال exposure، يعني لما يكون عندهم تعرض للمعادن. طبعا هذه المعادن ذرات تدخل الرئة يعني تحدث دمج. بالفاير فايترز أيضا لما يتعرضوا للدخان ويتعرضوا لكثير من الذرات. جماعة اللي بيشتغلوا في الأخشاب أيضا تدخل في الرئة. جماعة اللي بيشتغلوا في الجلاس في القزاز والصخور. وأيضا درسوا جماعة اللي تعرضوا لما صارت مشكلة اللي هو 9/11. وأيضا أي شيء مشابه لما يكون في ذرات غبار كثيرة تدخل الرئة والتعرض إلها حتى لو لفترة بسيطة. Pulmonary alveolar proteinosis, the disease with the second highest occupational burden, 29%, was associated with a broad range of exposures, including vapors or gases such as cleaning fluids and hairspray, inorganic dust such as silica, organic dust such as wood and metal dust, or fumes such as aluminum. 14 occupational lung diseases cost like $14.5 billion dollars of health expenditure, including $2.2 billion attributed to COPD and $1.5 billion to asthma. The treatment of occupational lung disease. All these occupational lung diseases are typically treated by primary care providers, occupational medical physicians, and or pulmonologists. Acute onset diseases may resolve on their own once the employee is removed from the offending exposure. يعني ممكن أن يختفي هذا المرض أو على الأقل resolve بدون أضرار إذا غير مهنته. Chronic diseases are often indolent, often with a latency period, and show a slow progression over many years or decades. Often, by the time of diagnosis, many pulmonary conditions have sufficiently progressed so that the most effective treatments are symptomatic. يعني زي ما بيقولوا الدمج حصل وما بتقدرش تعمل شيء سوى انك تعالج تخفف الأعراض سواء ضيق النفس أو ربما إذا ما كانش البروجرس لساته شديد إنك تخفف من البروجرس فيما يتعلق في الفايبروسيس lung fibrosis. All these are largely treated with inhaled bronchodilators, inhaled corticosteroids, mast cell stabilizers, among other common medications. Treatment effectiveness of these treatments may be to slow progression or treat symptoms, but they are not disease modifying. يعني خلاص لما يبلش مسألة الفايبروسيس يا إما بتعمل إلها slow progression treat symptoms لكن ما بتقدرش تغير في طبيعة المرض. Treatment with modalities include supplemental oxygen, outpatient pulmonary rehabilitation, vaccinations, lifestyle changes with exercise and diet, medications and surgical interventions such as lung transplantations or lung volume reduction. هذه أيضا إجراءات جراحية ربما يكون لها دور في العلاج. Even with anti-fibrosis treatments such as the tyrosine kinase inhibitor nintedanib, these diseases will typically progress over time and lead to significant mortality. فبالتالي يعني هي هذه الأمراض خاصة عند الناس اللي تعرضوا في فترة من فترات حياتهم لهذه المسببات الدست وغيرها، وبغض النظر عن نوع المهنة اللي كانوا يمتد زي ما قلنا هي يمتد نشوء المرض إلى 20 أو أكثر سنوات، وعندما يبدأ السيمتومز تظهر يكون بنى الجسم أو اللنجز fibrosis وبلش يعمل progression، وبالتالي زي ما قلنا ربما يكون في بعض الأدوية مثل هذا الدواء اللي ما عرفناش نحكي اسمه يؤدي إلى البروجريس over time، يعني inhibitor كاينيز inhibitor، لكنه هذه الأمراض معروفة أنها over time lead to significant mortality. Because of difficulties in treatment, preventing ALD remains the most effective strategy. إذا الوقاية هي أفضل سلاح، أفضل طريقة، اللي هي إنه إذا ربما استعمل الكمامات، استعمل المي مع ربما الصخور اللي بقطعوها أو الأحجار أو ما شابه ذلك، تؤدي إلى تخفيف الإكسبوجر بحيث إنه ما يدخل إلى الرئة. Prevention. Most surveillance programs use symptoms questionnaires, spirometry, and/or chest radiographs classified using the International Labour Organization classification of chest radiographs for pneumoconiosis. فبالتالي هذه يعني مؤسسات دولية تعمل اللي هو الكويشنير سيمتوم، إنه والله شو من إيش بتعاني وما شابه ذلك، لكن بنفس الوقت تبع طرق القياس سبايرومتري من خلال أيضا الراديوغرافز، وبقيسوا من خلالها شدة ضرر الرئتين. Cancers of the lung and pleura are diseases for which computed tomography CT scan screening programs are in place to catch disease early. These screening programs are in line with the current professional guidelines to perform yearly CT lung scans to screen for lung cancer in asymptomatic adults aged 55 to 80 years who have a 30 pack per year smoking history and currently smoke or have quit smoking within the past 15 years. High risk workers may be similarly screened. بالتالي احنا بنتكلم قاعدين عن ناس كانوا بيدخنوا 30 packs per year، على يعني هذا أقل شيء، ربما في ناس أكثر منهم، أو الجماعة اللي هم أيضا high risk workers إنه في عمر الأيج 55 إلى 80 إنه نعمل لهم CT lung scans. إذا نتعرف على selected at-risk populations and occupations. Between 1990 and 2015, there were increases in average occupational exposure to diesel exhaust, 72% among men and 129% among women, silica, and benzene. Coal workers pneumoconiosis، coal worker pneumoconiosis اللي هو مصنف على بهذا التصنيف اللي هو International Classification of Disease number 10 J60 J67 بسموه أيضا black lung disease. إذا نتكلم الآن عن اللي هو مرض الجماعة اللي بيشتغلوا في مناجم الفحم. has seen a recent resurgence in prevalence and severity. هذا المرض اللي هو بصنف حسب التصنيف العاشر للأمراض International Classification of Disease. Respirable fine crystalline silicates and metal contents of coal mine dust has been implicated. إذا إيش اللي بيسبب هذا المرض؟ Respirable يعني تدخل في الرئة من خلال التنفس، crystalline silica هكذا تسمى السيليكا، موجودة في ذرات الغبار، نوع من الغبار يسمى السيليكا. Silicates and metal content of coal mine dust has been implicated. يدخل إلى الرئة وتبلش الرئة تتراكم عندها المشاكل. Identified by a pattern of X-ray abnormalities and an exposure history. Mechanization of mining has reduced the number of people exposed but led to dustier conditions. Mining machine operators had the highest proportionate mortality rate. يعني صار في machines بتشتغل بدل العمال، لكن صار في dust أكثر، وهذول الناس اللي بيشتغلوا على هذه الماشينز صار عندهم proportionate mortality rate عالي جدا PMR among occupations. Coal workers pneumoconiosis increases in developing countries where dust control measures are often rudimentary يعني بدائية. Therefore غير كافية. Therefore an ongoing need to control and monitor for silica exposure in coal mining. Coal workers pneumoconiosis it is caused by respirable coal dust, particles of less than 5 micrometer in diameter. The higher the carbon in the coal, the greater the disease. 10 years or more of exposure must have elapsed before the appearance of chest X-ray changes. Risk factors for development of COPD in miners depends on تعتمد على ماذا؟ اللي هو lung disease, the duration and extent of dust exposure, prior dust exposure, and the presence of other risk factors, especially cigarette smoking and silica. Prevention and control. Primary prevention, reduce dust exposure. Respiratory dust standard set at 2 mg per cubic meter. Comprehensive industrial hygiene monitoring to measure dust suppression. Educate workers about disease risk and safe worker practices, and provide respiratory protection when high exposure is unavoidable. Secondary prevention, medical monitoring of coal miners and periodic chest X-rays. 2. Silica exposed workers in emerging industries. يعني الآن خلصنا من الكول ماينرز، بنشوف أيضا في وجود سيليكا بother industries. Increasingly, silica associated lung disease is being seen in workers in other industries, and often these workers are developing acute as well as chronic silicosis due to high exposure without appropriate protection. Industries ranging from stone masons اللي هم بيشتغلوا بالحجار, dental tool suppliers, jewelry makers, sandblasters, and denim jeans manufacturers among others. يعني مش خالصة الشغلة، كثير من المهن فيها تعرض شديد للذرات اللي تؤدي إلى silicosis وتؤدي إلى lung fibrosis. These industries have been largely overlooked as risk factors for silica-related lung diseases in workers. As such, early and aggressive screening and interventions are needed to protect the health of workers in a variety of silica-using industries around the world. فبالتالي يجب أن يكون هناك حذر وعلى الأقل تعريف هؤلاء العمال بخطورة التعرض لمثل هذه الذرات، وأنها ستؤدي في النهاية إلى أمراض الرئة وتليف الرئة وما شابه ذلك. Workers exposed to airborne of clinically significant levels of respiratory crystalline silica and dust at places grounded with silica-containing sand, for example, equestrian, military, recommending watering of grounds to reduce airborne particle exposure and occupational health training of these workers. يعني equestrian اللي هو الفيلدز اللي بتركض فيها الخيل على سبيل المثال، هذه كثير من الأحيان تكون رملية، وبالتالي يطير الغبار مع جري الخيل. وأيضا بالنسبة للجيوش اللي بتمشي أو تكون شغلة في مناطق رملية. عادة يفضل حتى إذا كنت يعني تشتغل في منطقة بهذا الشكل وفي مجال الووترنج، إنه الجراوندز تكون مرشوشة بالماء حتى ما يتطاير هذه البارتيكلز. نأتي إلى الهيلث كير workers. أيضا they are at risk. Increased risk for contracting many infectious respiratory disease and in particular for latent tuberculosis, cell infections, and active tuberculosis disease. The group with the highest prevalence of positive tests was nurses, pooled estimate 54%. Physicians had the second highest prevalence of positive tests, 48%, 35% among healthcare worker categories. General service workers include cleaners, drivers, housekeeping. For tuberculosis and occupational asthma أيضا هذولا معرضين. Laundries, dry cleaners اللي بيشتغلوا في dry clean وفي الغسيل, and pressure were found to have the greatest risk of lung disease resulting from occupation exposure to cleaning products لو تعرض لمواد التنظيف. Asthma was the most reported occupational lung disease in these workers, followed by acute inhalation incidents. The most frequently encountered chemicals were aldehydes and chlorine. Silicosis, ICD-10 اللي هو J62. Silica from 28% of earth crust اللي هو form 28% من earth crust. هاي السيليكا يعني موجودة بكثرة. The crystalline forms are most toxic اللي هو الكوارتز، بنسميه أو بيطلقوا عليه اسم كوارتز. Occupational exposure is worldwide, but the disease is decreasing in developed while increasing in developing countries. Silicosis is caused by chronic inhalation of respirable particles of crystalline silica, characterized by predominance of small, rounded X-ray abnormalities in the upper lung fields indicative of fibrosis. Histopathologic hallmark is the formation of silicotic nodules containing birefringent particles classified into simple and complicated progressive massive fibrosis based on the size of chest X-ray opacities. The disease may slowly progress to respiratory failure. Silicosis patients are at higher risk of developing TB. يعني تطور المرض هذا بالفعل انه يعني مجرد ما تذكر انه lung fibrosis وسيليكوسيس زي ما قلت انه هي التطور تاع slowly progress. Analysis of 9 studies of silica dust exposure indicate increased rates of lung cancer. Silica is now categorized as a probable human carcinogen. Caused by chronic inhalation of crystalline silica, a more toxic form of silica may be produced when quartz is heated or with freshly fractured quartz particles. Workers involved in heating and grinding quartz may be at greater risk of silicosis. Epidemiology. Exposure to respirable silica occur in many occupation settings. Surface and underground mining of ores containing silica, surface drilling, ceramics manufacturing, stone cutting, construction, silica flour mills, cement production, abrasive manufacturing, and use sand blasting. كلها اللي داخله في العمار وفي الاسمنت وتصنيعات البلاط وتصنيعات السيراميكا، كلها لها علاقة تصدر كثير من السيليكا. Silicosis is most prevalent among dry drilling or grinding of rocks high in silica and other activities that generate large quantities of respirable particles. Silicosis is 9 times more in men than women. Prevention and control. First line of defense is primary prevention, most effective way through elimination of respirable silica exposure reduction, maintenance through industrial hygiene monitoring program, and settings where silica dust occur. Second line, work education and training. Employers shall instruct each employee in the recognition and avoidance of unsafe conditions and the regulations applicable to this work environment to control or eliminate any hazards or other exposures to illness or injury. Use also protection equipment regulatory inspection. Enforcement of existing site standards keep silica concentration in the work environment within default limit 5 mg per cubic meter, which is reduced as the crystalline silica content in the dust increases. Third line in screening is screening. Periodic medical and chest X-ray screening enabling people with minimal disease to avoid additional exposure and prevent progression to more advanced phases. فنتكلم عن البريفنشن، هذه الخطوط العريضة اللي ممكن يقوم بها النظام الصحي لحفظ الصحة عند هؤلاء. asbestosis اللي العلاقة بالأسبست. ICD 10-1J61. Many countries have banned all use of asbestos. يعني حاليا أتوقع معظم الدول منعت اللي هو اليوز للأسبستوس. Its use in Europe, USA and many other countries has significantly decreased production of asbestos, while raw asbestos fiber continues to be used in less developed countries. The risk of adverse health events from these sources of asbestos to worker or building occupants depends on the status of asbestos material. Where it is releasing asbestos fiber into the indoor environment, whether it is frequently disturbed, and how well maintenance activities are in containing release of asbestos fibers. إذن هل هي تدخل في البيوت released into the indoor environment، وهل هي settled ولا disturbed، وهو well maintenance بالنسبة لأماكن العمل أو أماكن السكنة. Adverse health effects include pleural effusion, pleural thickening, and plaques with or without calcification, malignant mesothelioma, lung cancer. Asbestosis is the most common chronic lung condition. Often, clinical signs and pulmonary function abnormalities appear before X-ray findings. Diffuse fibrosis can result in decreased lung capacity, decreased gas exchange, and severe shortness of breath. Unlike silicosis, asbestos deaths are continuing to increase. Between 6% and 40% of insulation workers have detectable X-ray lung abnormalities اللي بيشتغلوا في الانسوليشن اللي هو العزل. In the US, asbestosis was identified as the cause of death in 7% of those who died. يعني صحيح في ناس تشتغل بهذه المسألة لكن إذا ما استعملوا البروتكشن سواء في العزل، سواء في البناء وفي الدهان، في كثير من المهن، إذا ما استعملوا القناع واستعملوا الماسك واستعملوا الإريجيشن سيدخل للرئة ويسبب اللانج فايبروسيس. عشان هيك بالأخير سموها ايديوباثيك لانج فايبروسيس، سواء كانت من الاسبستوس، كانت من السيليكا، كانت من أي سبب، هي تؤدي في النهاية وتمشي بنفس الطريقة بلانج فايبروسيس. أسبابها: exposure to airborne asbestos fibers. Magnitude of risk is directly related to both the duration and intensity of exposure to asbestos dust. Even brief heavy exposure can also cause the disease. يعني لفترة بسيطة لكن heavy exposure. Unlike other pneumoconiosis causing agents, asbestosis can be non-occupational to family members of workers bring dust home with them and to residents near mines or manufacturing facilities using asbestos. يعني حتى عائلة هذا العامل اللي بيشتغل وجاب معه على البيت، يعني بدون ما يقصد طبعا، ملابس مليئة بالدست تؤدي أيضا إلى وجود الدست في البيوت. Prevention control, primary, secondary. The primary asbestosis can be prevented by eliminating exposure to asbestos. New products containing asbestos are largely eliminated, but its release from existing materials must be controlled. يعني هاي مسألة تتعلق بسياسة الدولة أنها تضع حد كبير جدا للتعامل مع الأسبستوس. In all buildings, as product aging and deterioration continues, ongoing maintenance and repair can result in further release of asbestos. Legislations, قوانين, require accreditation of contractors working with asbestos and train asbestos workers to assure safety as well as prevent bystander exposure. يعني بدك تشتغل بعد الناس ما يكونوا قريبين للتعرض، وأيضا هناك تعليمات تنظيمات لهذه المهنة حتى ما يتضرر كثير من الناس. Safe work practices include identifying materials that contain asbestos, implement rigorous operating procedures such as wetting asbestos-containing material, wearing self-contained breathing apparatus. فبالتالي هؤلاء الناس اللي بيشتغلوا في الذرات هذه المتطايرة إذا ما سواء لبسوا هذه السيلف كونتين بريثنج اباراتس أو حتى الملابس اللي لابسين المفروض أنه يكون فقط في أماكن الشغل وتم تغييرها قبل الذهاب إلى البيوت. Secondary prevention, periodic chest X-ray, pulmonary function tests, positive results can encourage workers to avoid additional exposure, make workers more aware of the need for strict work practices, and encourage them to participate in health surveillance programs. Occupational asthma. The incidence of disease is increasing as it's becoming the most common occupational lung disorder in the developed countries. Work-related asthma includes occupational asthma and asthma aggravated by work or work environment. It is characterized by episodes of bronchospasm, airway inflammation, hyper-responsiveness to agents or conditions present in the work environment. Occupational asthma is distinguished from exacerbation of existing asthma by the presence of workplace sensitizing agent or acute exposure event. فهذا ما يميزها عن اللي هو الأسمى العادية. Overall prevalence of occupational asthma varies by region, with estimates ranging between 10% to 23% of all adults with asthma بسبب occupation. 50 to 90% of individuals with occupational asthma will continue to have symptoms even after being removed from the source of exposure. It may be difficult to establish that asthma is caused by an occupational exposure. The fact that initial symptoms may occur only at home or after work can be misleading. فبالتالي لأنه اختلاط هذه المسألة، يعني زي ما قلت إنه ممكن العضو بالعائلة، الابن أو الزوجة أو ما شابه ذلك، يتعرض إلى الغبار اللي بيجي من برا عن طريق العامل أو عن طريق التعرض إلى بيئة وهكذا. لكن يصعب إنه to establish الكوز إنه والله بسبب التعرض، إلا إذا كان في هيستوري تعرض مباشر إلى هذا الoccupation hazard. Over 350 causative agents have been associated with occupational asthma, including materials of plants and animal origin, chemicals, metals, biological enzymes, drugs. Agents are classified as high molecular weight compounds or low molecular weight compounds. High molecular weight compounds include proteins, polysaccharides, peptides, include an allergic response by stimulating the production of specific IgE, immunoglobulin E, and sometimes IgG antibodies. Depending on the level of exposure, prevalence of asthma from these compounds is high. 3 to 30% in animal handlers, 10 to 35% workers exposed to biological enzymes that are used in laundry, detergents, and other cleaning agents, 20% in bakers, الخبازين, 29 to 40% using epoxy resins, 70% workers exposed to platinum, salts, metallurgy, and photography. فمهن كثيرة لا مجال لحصرها تؤدي إلى occupational asthma. Low molecular weight compounds such as cyanates, wood dust, metals, and drugs. Allergic response involving IgE وهو is less frequent. الcauses. Materials known as suspected allergic properties account for the majority of causes of occupational asthma. Occupations with high prevalence: animal handlers, bakers, millers, chemical, detergent, electronics, farms, fishery, grain, insects, hairdresser, leather, carpentry, metal, paper production, pharmaceutical, plastic, automobile repair, painting workers. هذول كلهم أيضا occupations with high prevalence. The risk of developing occupational asthma is related to magnitude exposure for many agents. Atopy, allergy, a hereditary tendency to react to specific allergens is an important risk factor for occupational asthma from high molecular weight compounds, but not for low molecular weight compounds. كيف نعمل prevention؟ نعمل control. The only way is to avoid work and work sites where exposure to certain levels of agents occur. Facility managers have to know what agents in their plant have been associated with asthma and inform workers to maintain exposure below known sensitizing levels. أيضا, material safety sheets should include information on components that may cause or exacerbate asthma. إذن في شيء اسمه material safety sheets. Workers to be educated and trained on proper handling of materials and avoiding spills. Improved ventilation and use respirators where exposure is likely to decrease risk of disease. When sensitization occurs, the only remedy for affected worker is transfer from area of exposure. خلاص خليه ينتقل من هذه الشغلة. If transfer is not possible, it is debatable عفوا to allow him to work with the suspected compound even when protective measures are instituted. زي ما حكينا الأفضل اللي هو to be transferred حتى لو حطيت protective measures. Deaths have been recorded when sensitized individuals have been exposed in the workplace, while desensitizations have not been effective. يعني مسألة زي ما قلنا هي مع وجود هذه البريفنشن والكنترول، لكن لما يطب المرض يعالج symptomatically لأنه هو progressive. بهذا نكون انتهينا من محاضرة Occupational Lung Diseases.